We give adjuvant therapy, which is preventive therapy for breast cancer. We think it's fairly easy to decide whether to give a pill or not. So the pills would be endocrine therapy like letrozole or tamoxifen. And that's a pill that's given once a day. The side effects are mostly menopausal type side effects with hot flashes, some joint stiffness. But the bigger decision is whether to give chemotherapy or not, because chemotherapy has higher short-term risks. Most of the regimens cause hair loss, and there are some long-term risks with cardiotoxicity and neuropathy, that kind of thing. So the big decision is whether to give the chemotherapy in addition to the endocrine therapy, and that's where the Oncotype DX comes in to try to help you make the decision to do that. We also look at the size of the cancer, though, and the lymph node status and the grade of the cancer in making the decision as to whether to give chemotherapy or whether not to give chemotherapy and just endocrine therapy. She had a fairly large hormone receptor positive, HER2 negative cancer, and it was high risk on Oncotype. So the chemotherapy choice of an anthracycline with a taxane would be what I would suggest, just based on the fact the cancer was so large. There is some debate, though, with hormone receptor positive or even negative cancers now as to whether we should be using anthracyclines in that setting. A trial was done that studied 6 cycles of Taxotere with Cytoxan, which is not necessarily a benign regimen, with the standard anthracycline and taxane containing regimens. In patients who had lymph nodes that had cancer in them, the anthracycline containing regimens were really better. So in patients who are higher risk that have hormone receptor or negative disease, and you're debating whether to use an anthracycline and the lymph nodes are positive, I would say use the anthracycline. However, in patients with negative lymph nodes, say a tumor maybe less than 5 centimeters, 3 or less, I would say if you're going to use chemotherapy, 4 or 6 cycles of Taxotere with Cytoxan may be adequate. With the 5 centimeter cancer, I think there's room for debate in there. Some people would suggest using the 6 cycles of the taxane containing regimen. Based on her age and the high grade of the cancer and the fact that the tumor was so large, I do think it was acceptable to use the taxane and anthracycline containing regimen in her case.